Hello, I'm Dr. Laukkanen, and I'm going to talk about when radiation follows if a person has had a mastectomy and then an implant. Thanks for joining me. And if you're looking at this in advance of an appointment with me, I look forward to your visit. So, when the breast is removed, an implant can be placed under the skin in order to create a shape which is as close as possible like the breast. So some kind of material is placed under the skin that has been drawn over to cover the chest wall. And many mastectomies have an element of skin sparing. So some of that skin is from the original area, and some of it may be otherwise derived. But that implant structure would be under some skin and a thin layer of fatty tissue, and it will then rest on the muscle of the chest wall or potentially be partially covered with that muscle. So, if there's a reason to use radiation to the chest wall, and often it can be because the nature of the cancer creates some risk of having microscopic tracking of cancer cells into that chest wall tissue. So if a person is going to have that radiation and an implant was done at the time of their surgery, that chest wall radiation will include the implant itself as well as the overlying skin and tissue immediately under the skin, and of course the underlying tissues of the chest wall. So if the concept is that radiation beams are going to skim through that tissue, when we look at it in more detail, we have radiation beams that incorporate, as you can see, the chest wall underneath. And where you see that yellow structure, that is the implant, and overlying, there's radiation energy being delivered to the skin and underlying soft tissue. So the implant will receive the whole amount of the radiation energy, and the nature of the implant is such that that inert structure is not going to respond. The response is in the tissues that are around it. And whenever a person has an implant, whether they have radiation or not, there is some risk of infection. There is some risk to the overlying skin. It's a bit more vulnerable because, after all, there's a foreign structure under it, and that skin has been brought around and on top of it. And then the implant itself can naturally induce the formation of some fibrous tissue around it. And sometimes it's a modest amount, and sometimes it can be substantial. And that makes the so-called contracture around the implant. And everybody's normal tissues are going to respond differently to that foreign body. And so there might be a different amount of that fibrous tissue formed. So when radiation is added, those risks of infection, of skin vulnerability, of that fibrous tissue formation, those go up. And if we look at studies of folks that have had an implant after mastectomy and don't have radiation, and those that do have radiation, an example might be tracking for infections not in the immediate postoperative period, but later, where studies report a 5% risk without radiation. They might report an 8% risk if radiation has been added. Or if over a period of a couple of years, about 1 in 8, for a variety of reasons, may have the implant removed, that number could be as high as 1 in 5 if the radiation has been added. Now, many people do very well with implants and radiation. There was a recently reported study that tried to describe any amount of what's called chest wall toxicity, pain, discomfort, infection, skin irritation, or even skin breakdown, uh, troublesome contracture, any form of chest wall toxicity. About 10% of folks that had these implants had some form of that. But if we look at that differently, about 90% didn't. The healthier that the tissues are to start, the less likely it will be that problems will arise either in the skin or the underlying tissues.